I'm going to just give general advice, and I just hope that you can take away one or two really helpful, important things from this talk that's just going to help you on your cancer treatment journey. All right, so we're going to get started. So chemotherapy and also immunotherapy, it is used really commonly to, target those rapidly dividing cancer cells. And as a consequence, your skin can get very dry and irritated. And so dryness and flaking is often something that we see commonly with this. Your skin can become really sensitive, and you can even have a photosensitivity, which is sun sensitivity to some of the treatments that you're given. Your skin can be irritated. You can even develop rashes. These can just be general irritation or eczema-like rashes, or there can be specific rashes depending on the type of treatment that you're on. Nail changes can commonly occur from treatment. And so just to dive right in and start with dry skin and different tips just to help manage this really common concern during treatment. So this is going to be very weather dependent as well. We're in Chicago or just outside Chicago. And so, summer versus winter is definitely going to play a role with our skin. But things that you can do to try to help this along is, try to limit the amount of time that you're in water. So try to aim for taking shorter baths or showers. Try not to soak in a tub. We really, try to say less than 10 minutes at a time when you're in water. You want to use gentle fragrance-free body washes. And I don't endorse any of these brands, but these are just some of the ones that I like. And so I just put some suggestions there. But Dove is a great brand, Oil of Olay, but you want to go for more of their fragrance-free options. Aveeno just started a oncology-centered line called Restorative Skin Therapy, which is really nice. All of these are available, Target, drugstores, but those are great options. Another helpful thing that people don't really think about is adding in oils. So you could add a little bit of Robothol oil to a bath. Robothol is Vanicream or Mayo Clinic's line that is very gentle, fragrance-free, that is hydrating to the skin. Or you could put an oil on at the end of your shower or bath, and that can be really soothing, if you're experiencing dry skin or itchy skin. Some people like bio oil. You just want to be careful not to put too much oil on so you don't get, a little slippery there in the shower. One of my favorite tips, and I always say this to all of my patients, is that when you're getting out of the shower, your skin is still wet, you can apply a thin layer of Vaseline. This could be petroleum ointment, CeraVe healing ointment, Aquaphor if you don't have a lanolin allergy, but some kind of an ointment base that you apply a thin layer to the skin and then you towel dry, and that can be really hydrating, leave your skin feeling really silky and smooth, and it's really helpful with any itching that you may be experiencing. And so this trick may sound like it's going to be very slimy, but when you apply it to damp skin, it can be really, really helpful. Some moisturizers that I would recommend, you want to stick with fragrance-free, gentle products. You want to aim for more creams that are going to be more hydrating to the skin versus lotions. And I like ones that are in pump bottles just because your immune system is often on the lower side when you're going through treatment. And so, sticking your hand in a tub to kind of reapply can lead to infections. And so ones in a pump bottle are nice. Some of my favorites, I know I'd mentioned Mayo Clinic's line, that's Vanicream, widely available, Walgreens, CVS, Target, gentle, fragrance-free, free of a lot of different chemicals as well. The Aveeno Restorative Skin line is also really nice. And you want to apply this daily if you can while you're going through treatment. Facial moisturizers are a little bit different, still aim for those gentle fragrance-free moisturizers, but we recommend non-comedogenic. Comedone is just the medical term for pimple, and so we don't want to clog the pores. And so Vanicream, their facial moisturizer, is a nice one. They've got ceramides, hyaluronic acid, hydrating products are typically really helpful. I like La Roche-Posay's double facial moisturizer as well. More of a medical grade product is called Epion's. We carry this at our office. You can also buy this online. It's a botanical product, but it's also very hydrating and helps to restore that skin barrier, which is really nice. You could also find other moisturizers that have an SPF built into it, so you're kind of killing two birds with one stone. So CeraVe has an SPF built into it as well. Vanicream also has one. So depending on if you want to apply your moisturizer first and then your sunscreen, or just incorporate it all together, that's up to you. So flaky skin is kind of like that fish scaly like skin that can happen where the skin is just not exfoliating quite like it should. And so the skin starts to build up, leading that scale onto the skin. And so sometimes it just needs a little bit of help to naturally exfoliate. And what I like are creams that contain salicylic acid or lactic acid. These can be found over the counter as well. And CeraVe's got a great one. Amlactin has one. There's also prescription strength Amlactin as well, but these are really helpful. Downside is they can be a little bit irritating. And so I find it helpful to alternate with like a really good moisturizer so that you don't have any irritation or burning from these moisturizing creams. If you're experiencing itchy skin, you can always talk to your doctor about this, but we've got light therapy and all kinds of different options that can be really helpful. But over-the-counter options that are soothing to the skin, that help to calm the itch, are there's a lot of different products out there, but some of our favorites are pramoxine containing. So that's Sarna Sensitive Skin or CeraVe Anti-Itch. Aveeno's Restorative Skin Therapy line also has their version that contains pramoxine. And pramoxine is an ingredient that really helps to calm that itching sensation. So that's a nice one to use as well. These are just general guidelines. You could always run it by your physician that is taking care of you as well, just to make sure that they're on board. One often neglected component to your skin is your laundry and the clothes and all of your towels and products that you're using on a daily basis. Don't forget what you're washing your clothes in. I recommend using fragrance-free detergents. So All Free and Clear is a great brand. Ecos, there's so many different versions, but make sure it's free of fragrance and free of a lot of different chemicals. You want to rinse the clothes at least once or twice extra to make sure that those chemicals and soap are off, because your skin is so sensitive. I would not use any fabric softener or dryer sheets because they often lead to skin irritation and rashes. And then you could consider using wool balls instead of a dryer sheet, but just be very cautious with essential oils. I've seen a lot of allergic reactions from essential oils, so just be cautious if you want to use those on the wool balls. Scalp care. So hair is often affected by chemotherapy. It can get brittle, fragile, and a lot of times it ends up thinning out and falling out temporarily. And so, taking really good care of your scalp is important. And so I generally recommend using really gentle products. So if you still have hair, you can use more fragrance-free shampoos. The Vanicream Free and Clear line is really a great one, available, at CVS or Walgreens. And they have gentle conditioners as well that even if you've lost your hair, you can massage that conditioner into the scalp, and that can be really hydrating for the scalp and help to just decrease irritation. Occlusive, scalp covers or wig caps and wigs in sweaty, hot environments can sometimes lead to more acne-like breakouts. And so if you're experiencing acne-like rashes, you could consider adding in more of an acne-based shampoo. So one that we like is by CLN or Clean. There's one called Healthy Scalp that's nice. You could consider keeping the area dry with like a cornstarch powder if you feel like you're having increased sweat underneath your wig. And then there's also a gentle version of the CLN shampoo as well for just overall dryness. Another tip, I really like the Avene hydrating spray. So especially during the hot summer months, if you're feeling really hot and, you just want some moisture, it can be really hydrating to just spray that on the face or the scalp to decrease irritation as well. This is just available over the counter as well. So sun sensitivity, this is a big concern when you're going through treatment. A lot of these medications can make you more sensitive to the sun. So you need to try to avoid midday sun, go out for walks, morning time, evening time, try to wear sun protective clothing. And then on the sun exposed areas, you want to look for more broad spectrum sunscreens. We really like mineral based sunblocks. So this is sunblocks that contain mostly zinc oxide or titanium dioxide or iron oxide. There's different sheer variants that are not going to leave your skin, with that white thick coat that it used to, years ago. So you can get a really good block and, you want to aim for at least SPF 30, if not 50. And reapply every 90 minutes if you're going to be outside. Going to move on to the next one. So we know that we often don't apply enough sunscreen. And so one way, there were some studies that were done that suggested that maybe we should apply 2 layers of sunscreen 15 minutes before we even go outside to get adequate coverage. So I would recommend, a little more sunscreen than you think is necessary. So the general rule of thumb is 1 ounce for the full body and then about 2 finger lengths for face and neck. And don't forget your ears when you're applying the sunscreen. Different sunscreens that I like. There's so many different versions that are out there that are wonderful, but some of my favorites, Elta MD is a great one for the face. They also have a sport variety that's good for just everyday use, but it's mineral based and there's great SPF and it's sheer, feels good on the skin. There's a clear one for more acne prone skin. There's a tinted one if you prefer tinted versions. There's a lip balm, which is really nice. You can buy this online or doctors' offices typically carry it. We carry it at our office as well. The Think Sport is nice. There's also like a Think Baby version of it, but it's free of chemicals, mineral based. There's zinc oxide 20%, and that's a great one. Blue Lizard is Australia's mineral sunscreen. It's a wonderful line. You can find this at Target, and just make sure that you're really reapplying. For people that are going through treatment, if you need to reapply sunscreen, powder sunscreens are really helpful that are mineral based. So ones that I like, Color Science is a great one. There's also Supergoop. That's a really good one over the counter that you can find at department stores. We carry one called Zeo at our office, but it's an easy way to reapply sunscreen without, leaving like more of a sticky film on the skin. Sun protective clothing, so long sleeve shirts, gloves, there's wide brimmed hats, there's stylish versions now of sun protective clothing, but it is really important to wear this while you're outside just to make sure that you are protecting yourself from the sun. Nail changes. So nail changes are really common. Just like these medicines can affect the skin, they can also affect the nails. The hard part with nails is that they take about 3 months or 6 months to fully grow out your fingernails, and then your toenails take about 1.5 years. So it's going to take time for these changes to resolve. But brittleness is common. You can get ridging of the nails that are longitudinal. We call that oncorexis. You can get peeling of the nails like what's in this picture. That's called onchoschisia. And so we recommend, you can massage lanolin containing nail conditioners into the nail to try to strengthen the nail. Even Vaseline-like products or Eucerin Repair can be helpful to massage into the nail to try to strengthen the nail. Biotin is also helpful, but you would want to talk to your oncologist about this before starting any supplements, but that can be helpful to strengthen nails as well. If you're noticing peeling at the edges of the nails, there are urea-based nail products that can help just to smooth out the nail. Because there's cracks and your nails are often brittle and your immune system is often lower from these treatments, you are prone to secondary infections such as fungal infections or bacterial infections. So just be very cautious with manicures and pedicures. You might want to avoid this while going through treatment. Radiation is a very common adjunct for cancer treatment, and it often leaves the skin feeling kind of itchy, dry. You can notice a hyperpigmentation or darkening of the skin or sunburn appearance to the skin. We do have different lasers that can help with persistent redness that is remains after treatment, but it is considered cosmetic. Tips to lessen irritation. So we recommend wearing loose fitted clothing, fragrance-free, gentle products. So a lot of the products I mentioned before can be really helpful for, Vaseline can be really helpful and soothing to the area. This topical I have pictured is Biafine, is one that we often use for radiation or burns. We recommend that. It's very soothing, that you can also buy online or over the counter. You want to try not to scratch the area, and if symptoms are worsening, you could be developing a rash or a radiation dermatitis or eczema-like reaction in which you might benefit from prescription topical steroids. So you'd want to mention that to your oncologist. Scars post-surgery. So management of scars, there's been a lot of studies that silicone-based scar gels are helpful for improving the cosmetic appearance of scars. And so that can be a helpful addition after surgery when your surgeon gives you the okay and your stitches are out and your bandages are removed. And there are certain ones that have SPF that are helpful that you can apply daily. There's silicone gel sheeting, which is depicted here, that can be also helpful over-the-counter options. These all can be purchased online, Silogen or Biocornium. And, laser treatments also can be really helpful for scars post-surgery down the line when everything is healed to improve the appearance. So I just wanted to thank you. I mean, that's all I have for you guys today. I'm truly honored to be able to present to you, not just as a physician, but I also, am a cancer survivor. 4 years ago, when I was 32, I was diagnosed with stage 2, grade 3, triple negative breast cancer. And I underwent 6 months of 4 different chemotherapies and had a bilateral mastectomy as well. And I know how challenging going through cancer is. And I just, I know everybody's experience is unique. And for me, I really found that even though it is a dark time, I really found that cancer shone a light on the beauty and the miracle of life. And I just, want you to stay strong and take it one day at a time, and end with this inspirational quote. Michael Douglas, who's an actor and stage 4 esophageal cancer survivor: "Cancer didn't bring me to my knees, it brought me to my feet." So thank you, everybody, for listening, and I hope you took away some helpful tips, and I'm here for any questions.